Hi guys, welcome to our channel PKR Vibes Career and Growth. First of all, thank you so much for your time to spending here to learn something new. Today we will discussing about part 2 video of top AR caller interview questions along with the answers. Okay, here the question is what is global period or global to surgery? So when surgery is rendered, there should be a follow-up visit regarding that particular surgery. Is called as a global period. So for example, I am a patient. I went to the doctor and so my leg, I took a surgery, leg surgery from the doctor. So it is a minor surgery and the doctor suggested that till 10 days you can come anytime. So your last date for the follow-up visit is the 10th of this month. For example, I went on January 1st and January 10th is the last date of this minor surgery follow-up visit date. That duration of 10 days is called as a global period. So if I have any problem regarding that leg fracture, for example the leg is getting pain, so that is related to that surgery, so I can visit the doctor regarding that follow-up, that regarding that surgery. It is called as a follow-up visit. So the period of 10 days is called as a global period, or we can also known as a global to surgery. For example, the surgery is a major, so the effect of the that surgery is will be uh, severity or effect of the surgery is more compared to the minor surgery. So that's what they will give, the global period is more compared to the minor surgery, so it might be up to 90 days. So the global period is nothing but 90 days for the major surgeries. So that is what the global period or global to surgery. So if any interviewer asking the question what is global period, if you are giving explanation with examples, then it should be very good compared to other people. Please note this point. And second question is what is waiting period? So your answer is time that before health insurance can start or can went into effect. So for example, if you are trying to buy any insurance plan, then insurances will give you time waiting period based on your previous diagnosis history. For example, and previously you have some disease, so based on that diagnosis and the symptoms of the diagnosis, the insurance will not give the benefits in immediately. So based on that previous diagnosis, they will give you 2 months waiting period or 1 month waiting period or 3 months waiting period. So after 3 months only your insurance will start giving benefits to you, even your premium is started now. Even you, for example, you are taking policy today, so you have to give the premium January, February, March also. So they will tell that your waiting period will be the 3 months. So your service, even you get the treatment from the doctor, you should have to pay yourself. After 3 months, then only insurance will start giving the benefits to you. So this is called as a waiting period. So part of a time that before health insurance coverage can start or went into effect. So uh, the insurances will not give fixed waiting period for everyone. So it is a depend on your diagnosis also, depend on your previous history. So this is a also very important question. And coming to the next question, what is Medicaid eligibility criteria? See, so in part one video, I already given what is Medicare, traditional Medicare eligibility criteria. So now this is the question, what is Medicaid eligibility criteria, state Medicaid eligibility criteria. So here I given below poverty people, means uh, they are economically very poor, so they don't have any incomes for them. So they that is they are dependent on a charities and any funds. So these people are called as a below poverty people, and a pregnant woman, and the dependent children, the children who are dependent by some others, not have any parents. For example, they are dependent by someone else for the basic needs, food, shelter, so clothes, like that. So those people are called as a dependent children. So those dependent children are also eligible for the Medicaid criteria. And the blind people, so lack of vision, so that is called as a blind people, right? Those also eligible for the Medicaid, state Medicaid eligibility criteria. And low income people, so low income people means they have a income but they are very low. So certain low income people will also eligible for the state Medicaid eligibility. So the state Medicaid will give the benefits for this kind of peoples. So the next question, the fourth question I given is, what is place of service? 23. So there are multiple place of services. So if I'm giving this question, you should have to also have a look over through other place of services. That is your job. So now we will discuss about what is a place of service 23. So generally the place of service is nothing but the place where the service is given by the doctor to the patient. The place or area or the room, so or the atmosphere, that is where the service is given by the patient, sorry, doctor to the patient. That particular area is called as a place of service. So here the POS 23, place of service 23, is a emergency room hospital. So a portion of hospital where the emergency diagnosis and treatment of illness or injury is provided. So here the terminology I given like diagnosis and treatment. So diagnosis is nothing but symptoms. Treatment is nothing but the treatment for that symptoms. So where the treatment is given, that portion is known as a place of service. Here emergency room is a place of service for the 23. Okay, here the fifth question, what is modifier 76 explains. So generally modifier is nothing but giving additional information to the insurance company about the CPT or procedure whatever we build to get a payments. So here the modifier 76 is nothing but a repetitive procedure on a same day by the same doctor. For example, doctor giving a service to the patient on a morning hours, and the same doctor giving a same service to the same patient on a evening hours. So repetitive procedure or repetitive service by the same doctor on a same day itself, that is called as a modifier 77. So the service given to patient more than once on a same day by the same doctor on a different timings is nothing but modifier 76. Or simply you can give the answer, repeat procedure on same day by same doctor, that is modifier 76. So here I given one query to you, what is modifier 77? So guys, if you know the answer, please do your answer in a comment so that I can understand how many people are give the correct answer. Okay, explain non-covered scenario. A non-covered scenario denial links given in a first comment of this video, and also I will provide in the description also. So guys, please explore the link for complete or for more information. And also please note one point, if any interviewer will ask, if ask you any scenario, first try to explain like there are three steps, three ways. One is called as a pre-call analysis on a denial, and on-call queries on a denial, and what kind of action you will take on a denial. So in that way, in that pattern you will explain, so that it will be good impression to the interviewer. So here the seventh question I given is, tell me the common denials on which you are working in a previous companies. So guys, if you are 2 years, 3 years or 1 year experience, if you are looking for job change, definitely they will ask this question, tell me the common denials on which you are working on a previous company. So generally here I given examples, timely filing has been expired, duplicate claim, or authorization required, or there is no authorization, referral is required or referral is absent, non-covered services, or procedure code inconsistent with the diagnosis code, or CPT inconsistent with the modifier, or CPT inconsistent with the place of service, or that CPT is inconsistent or not appropriate with the patient age whatever we build, and service may be covered by another payer or service not covered by this payer. So patient is enrolled in a hospice or patient is enrolled in a skilled nursing facility, so our policy is inactive on a date of services, and nothing but policy lapse, and claim is denied for medical record, or claim is pending for medical record scenario, and provider not eligible on a date of services, and primary paid more than secondary allowed amount, or maximum benefits reached or met, or claim is denied for primary UOB, and information is requested from the patient. So like that, so many denials are there. Just you will give 5 examples here. I provided more means to get the uh, reference for other people. Okay, so guys, every scenario, again I'm telling, every scenario has a 3 steps: pre-call analysis, on-call steps, and particular end action on a claim. Please give the explanation in this way if any interviewer will ask the questions, and this kind of all scenarios already I covered in this channel, PKR Vibes Career and Growth, and there is a playlist AR denial management. Please go through that playlist for all this kind of denials. Okay, now we will discuss about the 8th question. What does PR204 means? It is a denial code stating that this service or a drug or equipment is not covered under the patient's current benefit plan. So nothing but the service is not covered as per the patient plan. Okay, now we will discuss about what is mean by reconsideration and an appeal, or otherwise, could you please give the difference between the reconsideration and appeal, they will ask you. So guys, already the reconsideration and an appeal difference video already I done, and also I uploaded in this channel only. So I will also provide that link in the first comment of this video, at the same time in the description of this video. If you need, could you please explore the link for the complete more information, so that you can understand what is reconsideration and what is appeal in clear way. Okay, now we will discuss about the last question. What are the common payers on which you worked on as in your previous organization? So what kind of common insurances you worked on a previous company is the question. So here I given Medicare, Medicare Railroad, Medicaid, Tricare, Champas, Champ, VA. So these are the government plans, guys. So government insurances, and I given here some other payers: USC Medicare, Aetna Medicare, Cigna Medicare. These are the Medicare Advantage plans. So and also I given the payers: Cigna, Aetna, Humana, BCBS. So these are the commercial insurances. So here, and also I provided VA community care. So it's such a different kind of payer. So USA dual plans, nothing but Medicare and Medicaid. USA dual plan of a Medicare, Medicaid. So it not dual plan, like that you can see the dual plans also. So you can provide any 3 or 4 on a interview, like Medicare, Aetna Medicare, BCBS, Cigna, USA dual, like that, so that they can understand you covered all the payers from the government plans, commercial plans, advantage plans, and also special plans. So guys, if this content is useful, could you please like my video, so that it will reach us many more needy people. So again I'm telling, thank you so much for your time to spending here to learn something new. However, have a good health. All the best. Bye for now.